Hi, my name is Kathleen Cummens. I'm a student at Maryville University. Today I'm going to be doing a head-to-toe assessment for my adult health assessment class. Brandy is my volunteer for the day. Before entering the room, we had her empty her bladder. She changed into a gown. We also obtained a full set of vital signs with height and weight included. We also tested her distant vision with the Snellen chart, and also her near vision with the Rosenbaum chart, which were both 20/20, and that's also testing the cranial nerve to the optic nerve. Upon entering the room and now just general inspection, her gait was steady, her manners appropriate, she was dressed appropriately, her speech is clear and articulate, she is oriented, she is well nourished and appropriate. Now moving on to the head and face assessment. I'm just going to be inspecting your head first and face. The head is normal, it's round and normal cephalic. I don't see any apparent masses, lesions, scratches, anything like that. The face is symmetrical, the eyes and ears, and they seem to be all normal. And upon palpation, I'm just feeling for any kind of indentations, masses, tenderness, which they all are normal and good. The facial bones now, palpating for any kind of tenderness. And good. And I'm going to test the, or palpate the frontal sinuses and the maxillary sinuses for any tenderness. And now doing the temporomandibular joint open. Good. Just feeling for any kind of clicking or popping. Now I'm going to test the cranial nerve 5, which is trigeminal nerve, and we're just going to do some light sensation. Brandy, I'm just going to have you close your eyes. I'm just going to touch you on the face, and you're going to let me know if you feel it. Feel it? Yes. In there? Yes. Is it equal? Yes. Good. Here? Yes. Here? Yes. Is it equal? Yes. In there? Yes. In there? Yes. And is it equal? Yes. Good. Perfect. Now moving on to cranial nerve 7, the facial nerve. I'm just going to have her make some different faces at me. First, I'm going to have you raise your eyebrows, close your eyes really tight, smile, clench your teeth. Good. Puff your cheeks out and stick your tongue out. Perfect. And those were all normal. Moving on to the eyes. First, I'm just going to inspect the eyes and the eyelids. The eyelids are symmetrical. There's no swelling, ptosis, no lesions or anything like that on them. The eyebrows are full and manicured. The eyelashes extend outwardly and are both symmetrical. The sclera of the eyes are white and intact with no lesions. I'm going to look at the conjunctiva of the eye, and it's pink and moist, which is normal. Now I'm going to look at the pupil reflex, and I'm just going to do it with a little bit of light. We're just looking to make sure that the pupils are round reactive to light and accommodation. And I'm just going to put this light, shine it in your eye. That is direct and consensual. Good. And direct and consensual. Good. Now, before I move on to any other of the pupil functions, I'm just going to palpate the lacrimal apparatus for any kind of excessive tearing or exudate, which I don't see any, which is great. Now to continue to move on to the function of the eyes, I'm going to have you do the cover-uncover test. You'll just cover one eye, look forward, good, and then uncover. And good. I'm just looking for any kind of extra movements of the eyes, which there wasn't any. Now I'm going to do test cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and the abducens. And I'm just going to test those with the 6 cardinal gaze. And Brandy, I'm just going to have you follow my pen light, and don't move your head, just your eyes. Good, and convergence. Perfect. Now just testing the visual fields. Brandy, I'm just going to have you cover one of your eyes. Just let me know when you can see my fingers. Now. Now. Good. And the other eye. Now. Now. Good. Now I'm going to move on to the inspection of the actual eye, looking for the red reflex with the ophthalmoscope. I'm going to start at 0, and I'm testing her right eye with my right eye. Good. And then moving on to the left, her left eye with my left eye. And good. All right. Now moving on to the ears. Just upon inspection, both ears are symmetrical. The placement is good. The top of the ears meets the outer canthus of the eyes. I don't see any signs of lesions, nodules, drainage out of the ears. And now I'm going to go to the palpation of the auricles. And they seem to be non-tender, no lesions are present, and they're firm and mobile. Now looking at the ear canal and the tympanic membrane of the ear. While I'm doing this, I'm just looking at the ear canal, looking to make sure it's clean, no excessive ceruleum, no signs of infection. The tympanic membrane is gray, pearly gray. All bony structures are seen, and I don't see any kind of bulging, redness, or anything within the eardrum. And I would also do that on the other side as well. Now to do the cranial nerve 8 testing, which is, I'm going to do the whisper test. I'm going to go behind you. I'm going to have you cover one of your ears. I'm going to whisper a word, and I want you to tell me what it is. Purple. Good. And cover the other ear. Apple. Good. Now I'll do some other hearing tests. I'm going to do the Weber test. I'm just going to strike my tuning fork. I'm going to put it on top of your head, and you're going to let me know if it's equal in both ears. Yes. Okay, good. And now moving on to the Rennie test, which is going to do test air versus bone conduction. I'm just going to strike my tuning fork. I'm going to put it back here on your mastoid bone. As soon as you can't hear that anymore, I'm going to move it in front of your ear, and then you're going to let me know whenever you can't hear that. Now. Now. And that's a normal test. The air conduction should be longer than the bone conduction. Now moving on to the nose. Just a general inspection. The nose is midline with the face. I don't see any apparent nodules, sores, or anything like that on the nose. Upon palpation, there's no tenderness, no abnormalities. I'm going to look inside the nose. And just looking at the mucosa, it is moist. The septum is intact. It is midline and no signs of perforation or bleeding. And also the turbinates, they are the same color as the surrounding tissues, and they are intact as well. Okay, now I'm going to test the patency of your nose. So if you'll just cover one nostril and breathe in and out. Good. Good, that's perfect. Now we're going to move on to the mouth and pharynx. First, I'm just going to look at her lips. They are pink and moist. I don't see any kind of cracks or lesions. And now I'm going to look inside the mouth. And I'm just looking that it is all pink and moist and intact. The tongue is pink and slightly rough. And have you go ahead and lift your tongue up. The ventral side is smooth and the frenulum is intact. Her gums and teeth. The gums fit tightly around the teeth, and there's 28 pearly white teeth with slight wear. The hard palate, have you open your mouth one more time. The hard palate is intact. The soft palate extends posteriorly from the hard palate. Just looking at the uvula at the back of the mouth, and it is midline and pink. The anterior and posterior pillars are intact. The tonsils are +1 grade, which is normal. Also, I'm just going to, there's no mouth odor. And then I'm also going to, test your gag reflex with awe. And that is testing cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve. So I'm just going to have you open your mouth and say ah, ah. Good. And then I'm just going to have you swallow for me. Good. And that's testing both of those nerves, which are normal. And staying with this, I'm going to go ahead and do the hypoglossal nerve, which is the cranial nerve 12, with some tongue range of motion. Going to stick your tongue out. Good. Side to side, up and down. And then I'm just going to have you push against my fingers with your tongue. Good, and that's all normal. Okay, moving on to the neck. Just inspection, the neck is smooth, it is supple. I don't see any signs of masses, extra pulsations, or any kind of thyroid goiters or masses. I also do not see any kind of jugular vein distension. We are going to do some passive and active range of motion. So if you'll just put your chin to your chest and back, and then your shoulder. Good. Look over your shoulder. Good. I'm also going to have you shrug your shoulders. Good. The shoulder shrug is testing cranial nerve 11, the accessory nerve. And I'm just going to have you push up against my hands. Good. That's perfect. And those are all smooth and without any kind of pain. Now I'm going to go to palpating the neck. I'm going to palpate the carotid pulses one at a time. I'm looking at her trachea position, and it is midline and normal. How you swallow for me. Good. That's testing the thyroid, and it moves smoothly up and down. Now to the lymph nodes. I'm going to just palpate for the occipital lymph nodes, the post-auricle lymph nodes, the pre-auricle lymph nodes, the tonsillar, submandibular, and submental. I'm going to do the anterior cervical chain, the posterior cervical chain, and have you go ahead and put your head to the side and do the deep cervical on both sides. The supraclavicular, the infraclavicular, and then the axillary. Good. I'm also going to auscultate the carotids and the thyroid, just listening for any bruise. And I'm going to be listening with the bell of my stethoscope. Just have you take a deep breath in and hold it. Good, and breathe. Breathe, deep breath in and hold it. Good. Breathe, and then I'm just going to listen to the thyroid. Perfect, and no bruises were heard. All right, and moving to the upper extremities, I'm just looking at the her arms, the shoulders. They're all uniform. They're all equal in length and size. The muscle distribution is normal. Hair distribution is normal. Her skin is clean, dry, and intact. And just feel for any kind of tenderness. Feeling in her hands. I'm looking at her fingers. I don't see any signs of clubbing or splitting of the nails. The nails are firm and soft. The capillary refill is less than 3. Going to be feeling for her pulses, brachial pulses, and the radial pulses. And those are all +2 and normal. Now I'm just going to go ahead and have you turn around. Then we're just going to be looking at the posterior and lateral thoracic and doing some tests here. Just upon inspection, the skin is uniformed with the other parts of the body. It is clean, dry, and intact. I don't see any kind of lesions or masses throughout the back. Her thoracic configuration, her AP diameter is less than her lateral diameter, which is normal. I'm just going to palpate the back, just feeling for any kind of masses or tenderness. And I'm also going to palpate the costovertebralar angle for any kind of tenderness. Okay. And that's all normal. Now, for the lung part of this, for the posterior and lateral, just looking at her respirations, they are equal in rate and expansion. Her chest rises and falls. Posterior chest rises and falls. The rate is normal without any kind of dyspnea or accessory muscle use. I'm just looking at the expansion now, and I'm just going to have you take a deep breath in and out. Good. I'm just making sure that my hands are moving equally with her breath, with which they were. Now I'm going to feel for any kind of tactile fremitus, looking for the decreased or increased fremitus. So whenever I put my hands on your back, I just want you to say 99, 99, 99, 99, 99. Good. And that's all normal. Now I'm going to percuss the posterior and lateral back, just listening for resonance and equality on both sides. Good, and moving on to the lateral, and just comparing each side. Good. Now we're going to test the diaphragmatic excursion. And Brandy, I'm just going to have you take a deep breath in and hold it. And I'm just listening for dullness. Good, and I'm just going to mark that spot and then breathe. And I'm going to have you take a deep breath in and exhale all the way. And I'm going to percuss up. Good. Just listening for that changes down, and that's about 3 to 5 centimeters, which is normal. And I would repeat that on the other side as well. Okay, now I'm going to have you turn back around. Oh, actually, I'm going to have you, I'm going to auscultate the posterior and the posterior and lateral chest, just for any kind of rales, wheezes, or rhonchi of the chest. And deep breath in and out. Good. Now moving on lateral. And like I said, just comparing both sides, listening for any adventitious breath sounds. And last one. Good, perfect. Okay, now you can turn around. Okay, looking at the anterior chest, heart, and lungs, we're just like, again, inspecting the skin. Everything is uniform, clean, dry, and intact. Looking for any kind of obvious masses, a difference from side to side in bone structure, which there is not any. Respiratory effort is unlabored, equal the rhythm and rate are normal, and I don't see any kind of pulsations or heaves. Now I'm just going to palpate the chest wall, just feeling for any kind of abnormalities, masses, tenderness. I'm also going to feel the precordium, just feeling for any kind of thrills, heaves, or pulsations. And I'm going to feel for the apical pulse, which is at the midclavicular line, 5th intercostal space. And that's all normal. And again, on this side, I'm going to do the tactile primitus with her saying the word 99. 99, 99, 99. Good. And I don't hear any kind of decrease or increase abnormalities there. Now I'm going to percuss the anterior chest for resonance and making sure they're equal on both sides. And that's all normal. Now I'm going to listen to the breath sounds on the anterior chest. And good. Lungs were clear to auscultation. No rales, wheezes, or rhonchis with that. I'm also going to listen to the heart tones. And the aortic area. Pulmonic. Erb's point. The tricuspid valve. And the mitral valve. And those are all normal, no murmurs or extra heart tones. Okay, now we're going to move on to the abdomen. We're going to have you lay down and go ahead and pull your shirt up so I can see your abdomen. I'm just going to go over to this side of the bed so that you can see me better. And first, I'm just going to inspect the general characteristics. The umbilicus is midline. I don't see any signs of herniations, pulsations, extra movements of the abdomen. I'm just going to look at the contour from the side, and it is flat. And no abnormalities there. Now I'm going to auscultate the abdomen. I'm just going to auscultate for breath sounds. I should be hearing breath sounds in each quadrant every 5 to 10 seconds. That's normal, and I'm also going to listen to the arteries. The aorta, the renal, the iliac, and the femoral. I'm just listening for any bruise there, which there were none. Now I'm going to percuss over the abdomen, the whole abdomen, all 4 quadrants, listening for tympani over the abdomen, and then dullness over the organs. And I'm going to percuss for the splenic borders. Let's start up high, just listening for dullness. The liver borders, sorry, not the splenic borders. I'll start that over. Liver borders. Listening for dullness. Good. I'm just going to mark that area there. And I'm just going to move up and mark that area, that's 6 to 12 centimeters, which is normal. And I'm going to have you roll over to your right side. I'm going to listen for splenic dullness. Good. That's all normal. Now I'm going to just start with some light palpation. This is just testing for any kind of tenderness, any masses, rigidity. That's all normal. Now some deep palpation. And again, any tenderness, guarding. And I'm going to do deep palpation of the spleen. I'm just going to have you take a deep breath in for me. Good. And then I'm going to attempt to palpate the, the liver, deep palpation of the liver. And then over here on the spleen, I'm going to attempt to feel it, but it is normal if you can't feel it. Okay, now I'm going to go to the kidneys on both sides. Good. The aorta. And then as I have you sit up, I'm just going to be looking at her stomach muscles, looking that they're all intact and symmetrical, which they are. Now I'm coming back over to this side. I'm going to be looking at her legs and feet. They are symmetrical in length and muscle distribution, hair distribution as well. They are warm to touch. I don't see any signs of edema. Her nails are pink. Their capillary refill is less than 3, and the nails are hard and smooth. I'm going to feel for the pulses, the popliteal pulse, the dorsalis pedis pulse, and the posterior tibial, and I would repeat that on the other side as well. And now to the musculoskeletal portion, it's going to be testing some reflexes. Just doing the upper extremity first, the brachial. Good. And the patella. Good. And then the Achilles. Good. All right, now I'm going to have you do some muscle strength for me. I just want to put your hands in front of you and push against me and pull. Good, and then on the leg, and pull, and then feet. Good, that's perfect. All right, stand up for me. I'm just going to be testing hip flexors and knees, and have you do a squat. Good, that's perfect. Have you turn around and bend over. And here I'm just looking at the spine, making sure it's aligned, no signs of scoliosis or kyphosis here, and hips are aligned. You can go ahead and stand up. Have you been back? Good. Side to side. Good. And then twist. Perfect. All those movements were done smoothly with no problems. And you can go ahead and have a seat. And now just to go over the cranial nerves and make sure we hit them all. The first cranial nerve is olfactory, which is the smell. We did not test that here. We would if we had the supplies, but we don't. The second cranial nerve is the optic nerve, which we tested with the Snellen chart and the Rosenbaum. The third, fourth, and sixth cranial nerve are the oculomotor, trochlear, and abducens, and we tested those with the 6 cardinal gaze. The cranial nerve 5 is the trigeminal, which we did with the light sensation of the face. The cranial nerve 7 is the facial nerve, which we did with the different face movements of the face. The cranial nerve 8 is the auditory nerve, which we did with the whisper test. Cranial nerve 9 and 10 are the glossopharyngeal and the vagus nerve, which we did with the ah and gag reflex and swallow. Cranial nerve 11 is the accessory nerve, which we did with the shoulder shrug. And cranial nerve 12 is the hypoglossal, which we did with the tongue range of motion. So that concludes our assessment, and thank you for watching.